Hi guys, my name's Carl. I'm a physiotherapist at the London Back Pain Clinic, and today I'm with Minhal and Roy, and we're going to discuss the impacts of COVID-19 on our practice. So, Roy, what did you kind of find with regards to the lockdown?
Well, leading up to the lockdown, I think it was very confusing for both practitioners and patients at the time. Patients were calling up, their work was already telling them to stay at home or work from home, so they didn't know if they could come in for appointments. We had to sort of accommodate that as best as we could, and it was just a very sort of difficult time leading up to the lockdown, because I think no one really knew what was going on at that point.
Yeah, I do remember like a big drop-off of patients.
It did drop off, yes.
I think as well, because we're a central London-based clinic, obviously people were coming into work. Their businesses were telling them, yeah, we're going to start reshuffling our business so that you guys are working from home now. So there was no need for them to come into practice as well. So then our list started declining off rapidly, to be honest. Within the month of March, it started rapidly going down. I also had patients coming in who lived locally in residential areas, were even asking, or even saying to us, like, should we be coming in? Like, you know, we don't want to break any rules, we don't want to put anyone at risk or anything like that. Should we be coming in? So I think, you know, when the lockdown got announced, I think we had to reshuffle our practice as well, isn't it?
Yeah, which brought us into our kind of remote consultations. And how did you guys find them?
Roy, how did you find it?
Challenging at the start. I mean, the way you communicate with patients is different. Certain bits of information get lost over a video consultation. Their body language, how they've walked into a clinic, how they move in front of you, you know, even facial expressions to a degree. So it had to be modified, and that sort of came with time. The more of them you did, the easier they got. It was a little bit awkward at the start, and obviously don't forget that we're a hands-on practice, you know, so I do a lot of manual therapy, very hands-on, and that was a sort of a big chunk of my practice that I couldn't perform through remote consultations.
I think, yeah, we had to rapidly shift to Zoom, isn't it? It was like within 3-4 days, we had to rapidly shift to Zoom. So we had to set up the PPS diary to allocate it to remote consultations. We had to tell our patients we're doing remote consultations as well. Some of them obviously happy with it, some were not happy with it. Because as you said, we're a very hands-on practice. Some patients will ask us, how are you going to continue with hands-on treatment if you're doing it via Zoom? So we had to make a rapid shift to our practice as well. I think, you know, the Zoom consultations had some advantages and disadvantages.
Do you want to diverge a little bit more into them?
So advantages that we had was we can continue to still see patients, not at the rate that we were seeing them, but we still managed to see patients. So I found out that the patients who are living by themselves enjoyed the Zoom consultations because they were able to speak to someone still, and this could be from a mental health aspect. You know, they were able to speak to a practitioner, not just about physiotherapy, just about general stuff that they maybe didn't have family or relatives close by that they could speak to. I don't know, what advantage did you find, Roy?
Part of the problem, especially leading up to it, was you sort of lost contact with already existing patients, right? So it was very difficult to keep on track and keep track of their progress as COVID sort of proceeded, let's say. So the Zoom consults at least worked in that respect, where we're able to maintain communication with already existing patients. And I mean, if that meant just making sure that we couldn't see them, couldn't do any hands-on treatment, but if we knew they were doing okay, if we knew they were doing their exercises, great, no problem. They can show them to us on Zoom. We can do a few modifications to them and then sort of keep track of them that way.
Yeah, personally speaking, from the advantages I saw, and sometimes I'd actually probably get some better outcomes, just because in a way the patient doesn't have any other choice but to empower themselves and do the kind of rehab and focus more on the long-term treatment. So in that way, we did have better outcomes. Now, so guys, I want to kind of talk about what kind of conditions were you kind of seeing when it comes to over lockdown or?
I think because a lot of people weren't very active, there was a lot of patients complaining of stiffness, muscle weakness, Obviously, there's a lot of patients who regularly go to the gym. The gyms were shut as well, so people weren't able to be as active as they were. I think working from home, they're not doing as many steps as they normally would. The only benefit was, I think, in March last year, we had brighter weather. The weather was really good. So people did start going in their gardens a lot more. From what I saw, there was a lot of mechanical lower back pains, mechanical neck pain, a lot of shoulder pain. And I think this is all from just working at the desk. The ergonomic setup wasn't correct. You know, they went from 6 screens in their office to 1 laptop screen sitting on their kitchen table, or sometimes on the bed, or just watching a wild TV. And this all impacted their soft tissue structure.
Yeah, it was a drastic change to what they're used to. And Roy, did you see any kind of variance to that?
I mean, just to add to his point, I think any time you change people's activities of daily living so rapidly, you're going to run into problems. So they go from living a certain way, an average number of steps per day, working a certain way, activities a certain way, to a 180-degree turn. Whether it's more or less, you're going to run into problems. So from a condition standpoint, I would say, and I have no objective data for this, but I feel like people started coming in with problems going higher and higher up the spine. So initially there would be a lot of lower backs. The longer they stayed at home, or the longer the sort of lockdown sort of took, a lot more upper back, shoulders, neck pain. Usually just related to the change in their desk, you know, the change in their ergonomic setup, and you know, again, like Minil said, the related stiffness.
I do think the desk gets a big blame, and I do think it was probably the majority of the clients, but I do think we always forget the person that's gone from no exercise whatsoever to I'm going to run 7 days a week, 10K. And, you know, obviously that's going to also have a big detrimental kind of response on their back. So we're talking about the Zoom consultations, but now we finally get to open up at last. What did you kind of experience as you kind of like the first clinic?
Patients were happy we were open because you know, we're recognised as a hands-on practice. So I think a lot of patients were asking us, when are you guys opening up again? And you know, I think we opened up again in late June, I think it was. Patients did start to come in slowly, in drips and drabs, but because, you know, we had to adhere to CSP guidelines, and the buildings we had to adhere to, you know, COVID regulations, there was a lot of setup within the clinics that we had to basically show so that we were following the health and safety side. So, you know, we had to purchase aprons, gloves, masks, face shields. We had to
eventually more testing.
Yeah, more. I think the buildings had to have track and trace on them. There was testing coming into the building. We had to clean the room and leave half an hour slots in between each patient. So there was a lot of structural things that we had to implement. Some patients got a bit annoyed at it, and some patients were happy with it. So there was a lot of structural things that had to be implemented for patients to come back in, but you know, we got there in the end. I don't know, what about you?
And I think some patients even preferred it, you know, so we'd get calls and they'd say, are you COVID sort of friendly, and, you know, are you taking all the sort of necessary steps? They wanted to know that they would be safe coming in.
So were you having some apprehension though with some of your patients coming back?
Not the regular patients, but I think new patients were sort of calling up sometimes, going, you know, with a little bit of apprehension. They'd be apprehensive anyway, but you throw in COVID as well, and yeah.
And do you think there's been a subtle change since, like, kind of there's been more of a vaccine rollout?
I think so. I think as time's gone on, people are less and less worried about the sort of about COVID itself. Obviously, they want to adhere to the rules. So anytime there was a second lockdown or something, you'd see the numbers drop off again. But when it came time to sort of open up a second time and moving forward, it was all right.
I think that's one of the main things we face as well, because obviously, as I said, because we're a central London-based practice, most people who came to see us were residential people who live in normally High Street, Kensington, Oxford Street. People who are still working from home, they would prefer to go to the suburb practices. I think what happens, once we were increasing our patient caseloads, when the cases started to rise again, we saw our caseload drop again. So we kept going from increasing, decreasing, which obviously had an impact on our practice because we can't maintain the treatment plan that we wanted to maintain. So sometimes the good thing was because we had Zoom in the background, we could always follow up with them and say, look, okay, fine, if you're not happy to come in, we can follow up your exercises via Zoom. So I think that helped.
So going forward, obviously there potentially could be other lockdowns in the future. What do you kind of recommend to our patients and our viewers?
One day at a time, keep going. Don't let lockdown sort of stifle you in any way. Don't let it change your life too much. I know it's difficult, but we've been through it before.
I did notice, particularly in the last lockdown and the one over the winter period, that the patients were just coming in just because it was something to do.
Yeah, I noticed that. So I think patients just came in because it was a way to get out it was an excuse to get out the house. But yeah, fine. Well, I've actually told my patients that when they do come in, they have asked the question, what do I do if there's another lockdown? I've normally said to them, look, we're going to get a treatment plan on the way. We're going to stick to hands-on face-to-face appointments. If there is another lockdown, we can continue with Zoom consultations. However, the good thing is about medical-based practices, the government has allowed us to stay open even if there is another lockdown because we're medical-based practices. So I have told them that we're allowed to stay open, but if they're a bit fearful, there's a bit of anxiety there, we can continue everything via Zoom.
All right, to summarize, guys, well, obviously lockdown took a little bit of time to get used to, especially with regards to using kind of remote consultations, because obviously the disadvantages of not being able to kind of assess with our hands and kind of even treat with our hands. So we had to get a little bit creative on the way that we could do things. However, there was some advantages with regards to empowering our patients by obviously having to focus on the exercises themselves, and also with we had to change our communication skills, and in a way sometimes patients kind of fed well from that. But then returning to practice, we had to make a few adjustments. Obviously COVID guidelines which kind of restricted us. We kind of had to dress up like we were ready for that kind of biohazard warfare. However, there was still some fear from people coming back into practice, so business was still a little bit slower. But since kind of the vaccine rollout, numbers have picked up massively. And I think even with another lockdown, I think we'll be well equipped to dealing with it again. So we'll still be around for your backs. But I'd like to thank Minal and Roy for their inputs. Guys, have a good day.